So welcome back. Today we will be talking about heartburn. We know it's a very ancient problem because the Sumerians and the Egyptians described it around 3000 BC, and we know that the Greeks and the Romans were actively treating it around 500 BC. And in fact, some of the treatments they've used then, we still use today. The patients would complain of burning around the heart because of where the pain was located. This is due to the layout of the body. So when we open our mouth, there are two pipes. The first pipe is the trachea. The second pipe right behind it is the esophagus. The trachea lets air into the lungs so that the body can breathe, and the esophagus lets food and drink into the stomach so it can be digested. Right in front of these two pipes is the heart, which is why irritation of the esophagus would present as heartburn. There's a small flap that protects the trachea so that food cannot go down the wrong pipe. At the very bottom of the esophagus pipe is a sphincter, a ring of muscle called the gastroesophageal sphincter. And once food passes through into the stomach, it closes very tightly so that the stomach can now use its very strong acid to break down that food further or to continue with digestion. However, if that acid escapes back up through that sphincter into the esophagus, it is called gastroesophageal reflux disease, or GERD for short. And if this happens enough, a few things can happen. Number one, the lining of the esophagus can change. It can get damaged. If it gets irritated, it's called esophagitis. And if the cells that make up that lining become precancerous, it's called Barrett's esophagus. Number two, sometimes that acid can go up too high and kind of drip into the trachea and irritate the lungs. So now the patient will cough more, their asthma will get worse, and sometimes they can even get an infection such as pneumonia. The way to treat this condition is to try to target about three things around the same time. Number one, keeping that sphincter muscle strong. So avoiding anything that would make it weak or would make it loose, such as not smoking, avoiding chewing of tobacco, not overeating, and controlling any diseases that would affect the muscle. Number two, keeping the acid in the stomach low by avoiding spicy foods, by managing stress differently, and using medications if needed. Number three, making sure that that sphincter doesn't have more pressure from below than what it already has, such as in a hiatal hernia that can push that sphincter up and then just won't let it close, or number two, obesity that can do the same thing through weight, which is why patients will often say that if they put their head up at night, gravity will pull those things down and they have less heartburn. In the end, treating GERD has to be looked at differently. For thousands of years, it was all about just making the stomach acid low. And now we know it's just as important to keep it in its place. As Jedi Master Yoda said, you must unlearn what you have learned. Until next time.